Okay, so I'll start with the acknowledgement today. I acknowledge the traditional owners and custodians of the land and waterways. We recognise their diversity, resilience, and the ongoing place the Aboriginal and Torres Strait Islanders people hold in our communities. We pay our respects to the elders, both past and present, and commit to working together in a spirit of mutual understanding, respect, and reconciliation. We would like to acknowledge the many lands on which we are meeting in person and virtually today across the Western Victoria region. We're in Wadawurrung country. If you look outside, it's okay, but Geelong's a beautiful place, so we're all good. So hoping that you guys are all good in whichever land you guys are standing in or sitting in or listening from. Okay, so we've got a bit of a jam-packed agenda today. So I'm going to be really quick with welcoming you all here and everywhere. So welcome everyone. It's great to see everyone's faces. We're also recording this session, so if anyone's got an issue, please, with recording or getting their faces out there, let your practice facilitators or anyone from PHN working in the room know. I'm hoping everyone's told you where the toilets are. Quickly, the toilets are out there, guys, if you need to go. And if you need the toilets anywhere else, please ask your PHN staff. All right, so I've also popped at the end of everyone's seat, you'll see paper and pens, just for any questions. It's really hard when we've got a big group of people and especially because we're doing hybrid and they're online, sometimes I don't hear the question. So write any questions down, hand it to the team around and we'll call them out. If we don't get to your question, don't worry, I'm going to send everyone an email and we'll answer all questions in the email. So we'll get started with Miss Sarah Crow from our digital team, and she's going to be talking about this life-changing tool called the self-assessment tool. So thanks, Sarah.
Thanks for having me, everyone, and Sharon. So I'm here today to let you know that Westvic PHN have a new digital health strategy. It's to cover from 2023 to 2026. It is available on our website if you go to the digital health page, and there'll be more information coming out in our newsletters around that strategy. But all in all, that strategy is about guiding and supporting our primary healthcare sector to make sure that everyone's got what they need and access to the tools and the training and support that you might need to be able to use digital health in your healthcare service. We want to be part of the solution in helping people all across Western Victoria to interact with digital health and have access to how it can improve your healthcare. We also want to advocate on behalf of our stakeholders. So you might remember we did a survey last year around how how people interact with digital health, both for providers and for our community members. There was online surveys and workshops that people came to. And we'll be doing more of that kind of work moving forward to make sure that we understand the needs across our catchment. Thanks, Sharon. So the very first step in being able to deliver this strategy, we need to understand exactly how our general practices are currently using digital health tools. So we're very excited to announce that we will be opening up a digital self-assessment tool. That will be opening on the 27th of March. And it will go directly to all the practice managers or equivalent in the practices. Now, each practice can only complete the tool once on behalf of your practice. And the reason we're aiming that at practice managers is because we think they're probably best placed to understand the broad spectrum of digital health use across the clinic. Some GPs or nurses might be very digitally capable and using tools a lot, and others in your clinic may not. And the idea is that practice managers are probably best placed to give an all-round opinion or information on how it's being used in your practice. What we're going to do with that information is use it to obviously understand how digital health is being used currently. And we want it to support and guide future training and support activities and communications that we do. So making sure that we are actually responding to the needs of the general practices in our catchment. Thanks, Sharon. So as I said, that tool will be coming out on the 27th of March. You'll see it noted in there'll be an article in our next Westvic PHN newsletter. So keep an eye out for that. It'll have some information around the tool that we're using. You can also talk to your practice facilitator about the tool, or you're very welcome to get in touch with me and my team by emailing the digitalhealth@westvicphn.com.au. The tool is basically a survey of a number of questions, most of which are multiple choice, in giving us a bit of information about how your practice is currently using digital health and what your future needs might be. So all practice managers, on top of the Westvic PHN newsletter, there'll also be a directed email to the key contact or the practice manager at the clinic with a link to go and fill that survey out. And I will let you know there's also going to be a few webinars that week available on the Tuesday and the Wednesday at different times throughout the day. They are just 20-minute drop-in sessions. Bring your cup of coffee along to have a look at the tool, have a look what you're going to be asked. So you're welcome to wait to attend one of those sessions if you prefer to before completing the tool. Thank you very much. I'm happy to take any questions, but I thought I'd keep it short and sweet today and just let you know what's to come.
Wonderful. And I look forward to seeing those 20-minute webinars. 20 minutes good. All right, guys, I'll go to the next slide. If there is any questions, I will just give it to your practice facilitator or to whoever's in your room, PHN people, and we'll get back to you with the answers. So I'm going to actually turn over to Miss Katrina Martin from our program lead she's a program lead workforce development in our development. Sorry, I've got all that wrong. Let me start again. She's a program lead in our workforce development, and she's going to be talking about CPD changes for our GPs.
Thanks, Sharon, for that nice introduction and for calling me Miss. I really liked that. Okay, so as Sharon said, I'm going to be talking about the CPD changes for GPs that came into effect from the 1st of January, and just making sure, I guess, that practice managers are across all of those changes. And just bear with me while I get my screens all organised. Okay, so the Medical Board of Australia has outlined new annual CPD requirements aimed at improving practitioner performance and patient care. So the main changes include the introduction of CPD homes. So this will be either RACGP or ACRRM. The introduction of professional development plans or PDPs. So this annual plan will be easily completed via the GP's RACGP or ACRRM portal, and it allows GPs to identify their learning needs for the year ahead. The third change is the requirement for doctors to do 50 hours of CPD per year, and a requirement for those 50 hours of CPD to be made up of different types of CPD activities, which I'll go through in a future slide. So this is just a comparison of previous year's requirements to the current triennium. So you can see that we've moved from 2 activity categories to 3 categories. And we've moved from a points-based system to an hours-based system. So previously, also it's worth noting the GPs had the whole triennium, the whole 3 years to obtain their points, which was often problematic because, of course, they leave it all to the end and then you're all trying to crack the whip and get it done. Now the requirements that 50 hours must be met each year, so it will work well to keep them on track better. It's also worth noting also that 130 points didn't add up to 150 hours over the 3 years. It is going to be an increase in the amount of time that GPs will be needing to commit to their CPD. So additional college requirements, so this is the CPR, that's not part of the MBA requirements, but it is required by the colleges and there's no change there, that they must complete CPR or basic life support every 3 years. So From the 1st of January, we're just looking at these different types of activities that have just been introduced. So we'll go through these one by one. The first is educational activities. So these are activities that expand general practice knowledge, skills and attitudes related to a GP's scope of practice. So these types of activities will be really familiar to you. They'll include things like lectures, webinars, workshops, reading, podcasts and courses. The second is measuring outcomes. So these activities are those that use GP work or practice data to ensure quality results. So these hours can be obtained by conducting activities like audits, quality improvement, research or evaluations. And the third activity type is reviewing performance. So these are activities that require reflection on feedback about your work. So feedback might come from patients, peers, or even from self-reflection. So some examples of reviewing performance activities include Project Echo, peer groups, special interest groups, and case-based discussions. So GP's 50 hours of CPD per calendar year must be made up of a minimum number of hours in each of the 3 activity types, as demonstrated on this wheel. The upper left quadrant in the medium blue colour demonstrates that 12.5 hours must come from educational activities. The right half in the navy shows that 25 hours must come from a combination of reviewing performance and measuring outcomes, with a minimum of 5 hours in each type. And the remaining 12.5 hours can be made up of any of the 3 activity types. So what's Westvic PHN doing to assist GPs to meet their CPD needs? So with our GP clinical advisors, Westvic PHN designs an annual education program tailored to meet the needs of our GPs, the local patient population and the health system. Westvic PHN is already working to develop activities and learning packages to assist GPs to meet their CPD needs this triennium. So there's going to be a renewed focus on peer group learning with activities such as Project Echo, and a continuation of our usual offerings like webinars, skills-based training, and of course our annual primary care conference. So as an accredited CPD provider, we provide education that meets the requirements of the colleges. We're rolling out a selection of education options which will allow GPs to plan ahead and tick off some or all of their CP requirements for the year. We'll also take a lot of that burden of paperwork off the shoulders of GPs by having accredited activities, uploading their hours for them to the dashboard and retaining all of the required documentation in case of the GP or the activity are audited by RACGP or ACRM, which they have to do a minimum number of audits per year. So it is likely it'll happen at some stage. And finally, we're working very closely with the practice facilitation team to develop quality improvement activities that will sit alongside the CPD offerings. So this will allow GPs to work independently or with other members of the practice to complete measuring outcomes and reviewing performance activities. So there's a number of new RACGP logos for you to keep an eye out for this triennium. So when you see these logos, you'll be able to recognise the number of hours and the type of activity that it's been approved for. Noting that the one on the very left-hand side, there will be some activities that will be a combination of the different activity types. So the following slides I'll go through will show how GPs can tick off some or all of their annual CPD requirements by attending various Westvic PHN activities. So education activities, the ones on the left-hand side, they're going to be the easiest for GPs to obtain. So they could easily obtain half of their annual CPD requirements by attending Westvic PHN activities such as our annual primary care conference, emergency skills training such as CPR, come along to webinars, town halls, workshops, and things like that. So it's actually that other side, that right-hand side of the wheel, the reviewing performance and measuring outcome hours, which we think will be the most difficult for GPs to obtain. But we're here to help, so we'll go through a couple of examples now. So for those of you I'll go through Project Echo first. So for those who are not familiar, Project Echo is an online case-based learning system where we connect up GPs with specialist teams in tertiary services So they have regular 1 hour online meetings, usually fortnightly, and each series has a different focus each term. So in this example, we can see that if a GP went along to participated in 4 echo sessions per year, they run via during school terms, with each series having 5 sessions, they'll qualify for 20 reviewing performance hours, which we'll upload for them. As I said earlier, we're working with the PFs to develop quality improvement activities such as mini audits and PDSAs, which will sit alongside the ECHO focus areas. So, for example, if we were doing an ECHO series on diabetes, we'd supply the attendees with quality improvement little mini audits, examples that they could then use to do while they're doing that ECHO series as well. And you'll have a whole group of them doing them at once. So you could opt to do just little mini audits, or you could do a whole of practice 5 or 10 hour activity if you wanted to. So it's entirely up to them, but we'll provide the examples. So you can see here, if GPs did this and came along to ECHO sessions throughout the year and then just their other usual CPD requirements, so that's their 50 hours done for the year, and they're just staggering it throughout the year. So some of your GPs might participate in peer groups and special interest groups. There's quite a few that Westvic PHN support, but there's others all around the region as well, or they might just do it internally with other GPs in your practice. So this is another way for them to obtain their reviewing performance hours. So peer groups and special interest groups usually meet around 8 times a year, so they can collect 8 hours for that. They can self-report those, or their coordinator might support them, or Westvic PHN might upload them. The group could also decide to work on a quality improvement activity together. So then they're also getting measuring outcomes hours there as well. So there's plenty of options there. So how can practice managers help? So one of the best ways is going to be to monitor where your GPs are up to with their hours and keep them on track. So don't wait until 3/4 of the way through the year to then go, I wonder how everyone's going. There's no way they're going to fit 50 hours of CPD in the last quarter of the year. So keep an eye on it throughout the year. How you do that will be, you'll work on that with your GPs. But just try to keep them up to date. This is a little snapshot of what their dashboard will look like. So you can see here, it shows the progress for each of the 3 different types of activities. The measuring outcomes and reviewing performance hours are combined. So that will give you a visual of where they're up to. Along the bottom, there's also, to the right, there's also sections where they'll complete their professional development plan and their CPR. And down the bottom, there's links to resources and guides, which are really great. Encourage them to get in and have a look at those. The second thing you can do is to, skipped through a bit too fast, is to help GPs to identify the activities they're already doing in practice as part of their everyday work. So this can be things like do they participate in regular case conferencing with their colleagues? Do they contribute to your accreditation process? So all of those sorts of things will count towards CPD. They're already doing them, they're just often not recording them. And they can record via if you see on the left-hand side where it says log, there's a drop down that says quick log. Basically, they just put in the title, what activity type it is, how many hours they spent, provide some additional commentary around that, and it's done. So it's not a difficult process to self-record those. The other thing as well here, I've put some links in for RACGP webpage, which gives CPD ideas for special interest areas, and also that the booklet is really good as well. I've taken a little screenshot down there on the bottom right hand side to show the types of things that will be included in each of the activities. So they give some pretty good examples in both of those documents. So how can you get some updates on Westvic PHN events? So if you're not already, you can subscribe to Westvic News, Practice Connect Communique, and they're always listed on our website as well. Your practice facilitators are always a great resource as well. From early July, we're going to have a new Workforce Development e-newsletter. So this will replace all of those individual emails that go out, all of those invitations that come out one by one. We're consolidating them all, and we're thinking it'll probably be a weekly e-newsletter. So all of the CPD, all of that education and upskilling will be all in one place. So keep an eye out for that, and you will be able to subscribe via the Practice Connect communique. And also just a reminder that all of our recorded webinars are on YouTube Learn. So you can, GPs and yourselves can watch them on demand and then just self-record your points as well. So in the meantime, you can contact Westvic PHN or the colleges via the phone numbers and email addresses on the screen. And I think we're having questions at the end. Thanks, that's it for me.
Thanks, Katrina. That was wonderful. I really, yeah, that you've made that easy to understand. Okay, I'm going to put our next talker on, which is the lovely Annie, but let me get the slides happening again. Sorry, Annie, bear with me.
Yeah.
Click through.
I'll just give a quick little intro. So hi,
Please
my
do.
name's Annie Henry. I work in the Public Health and Emergency Response team here at the Westvic PHN, and I'm sure that I've been in touch with many of you over the past couple of years to do with COVID. So I've heavily worked in the COVID space, previously with Claire Dagley and Linda Govan, and now that's sort of shifted over to a team of me and also Naomi, who's my manager. So we look after all things public health, emergency preparedness and emergency response across the catchment. So hello all,
Oh.
welcome.
I'll share. Have I
Yeah.
shared my screen? Yes, all good?
No, you haven't.
Oh, okay. It's always fun. Sorry about that.
You're right. So I think that Sharon actually had on the slides looking after COVID positive patients. So I'll be touching on quite a few things to do with COVID today, including vaccines and a couple of other things, but there will be a little bit in there about COVID positive patients and care as well, and what you guys can do in your clinic.
Sorry.
Do you want me to share my screen, Sharon?
No, that's okay. It's coming. Here we go. Sometimes my computer's got a mind of its own, I'm sure.
Oh, that's all right. It's all Katrina's fault because she wanted to share her own screen.
Yes, absolutely. Yeah. There we go.
Okay, so first up, I'm just going to give a little overview and an update on the vaccinations. So you will note that there has been a complete language change. So we're moving away from the numbered doses which individuals can have for their COVID vaccines, and we're moving on to time periods. So instead of there being dose number 3, 4, 5, anybody who has had a COVID vaccine in the previous 6 months or who has had an infection in the previous 6 months is now, anybody who has had an infection 6 months or more ago is now due for the next booster. So previously there was booster, 3, 4, 5. Now we're just moving on to the time period since their last vaccine. So anybody who has had a positive COVID infection or their last vaccine was 6 months ago are now eligible to have their next vaccine. I think that just sort of makes it a little bit simpler, and rather than trying to keep up with what number of vaccines people are up to. I mean, I don't know, and I'm, quite a normal, well-functioning person. It'd be really difficult to try and keep up for those who, may have some literacy issues or other stuff going on in their life. So it's 6 months from the previous infection or their previous vaccine. So the ATAGI, Australian Technical Advisory Group on Immunisation, have recommended, they are recommending the booster dose for everybody aged 65 and above, and anybody aged 18 and above who are at risk. However, the 2023 booster dose is available for anybody over the age of 18 and those children at risk between 5 and 17. So the language there as well can be a bit confusing. So the vaccine is available for anybody 18 and above but it is highly recommended for those 65 and above or anybody 18 at risk, over 18 at risk. So just keep that in mind. It is available, and if anybody presents to your practices who wants a COVID vaccine, if they're 18 and above, they're eligible for it. The vaccine is available for them. So for any of the booster doses, oh, hang on a minute, can you go back, Chaz? For any of the booster doses, the bivalent vaccines are recommended. So from the 6th of March, the Pfizer bivalent vaccine was available for those tranche 1 sites. And then from the 13th of March, it'll be available for the tranche 2 sites. There will be a Moderna bivalent 4/5 available in April. All clinics who are vaccinating will be onboarded for those vaccines. However, if you don't want to provide them, that's okay. You don't need to order them. And just a reminder as well, it's up to each individual clinic to update the vaccine clinic finder. So you will all have a login and username and password and all that for the VCF. It's really important that that is updated regularly with what vaccines you're providing, because that's essentially the source of truth for the community, for the department, on what vaccines are being provided where. So as part of your onboarding agreement, that is actually part of the agreement to providing COVID vaccines, that you do maintain and keep the VCF up to date. Okay, next slide. So vaccinations, again, the public health units previously, so we work with the Barwon Public Health Unit and the Grampians Public Health Unit. They previously were funding and eligible and able to go out and do pop-up clinics in areas where vaccine access was a bit problematic. They were going into aged care facilities, and all sorts of sort of community. They might have done a pop-up at a show or the sale yards or places where access has been, problematic. So they actually aren't able to provide that anymore. The funding through the Victorian Department of Health has backed off a little bit in regard to COVID vaccinations and COVID care, and it's more so moving on to primary care, which is where we all come into it. So with aged care facilities, obviously I'm sure that you're all aware that there's a bit of a push for aged care facilities to have their residents vaccinated. Instead of the public health units going in and doing those vaccine clinics as per they have in previous times, doing mass vaccination clinics, this is now sort of becoming more reliant on primary care. And I think that moving forward, the department are trying to make COVID business as usual. It's the world that we live in now. It's, it obviously is scary, but it's probably a lot more manageable than what it once was in earlier days. So in response to that, Medicare have implemented some changes through the MBS to make it a bit more accessible for GPs and clinics to be able to provide vaccines as business as usual. So what we're encouraging is GPs on their usual rounds, if they're from a vaccinating clinic, on their usual rounds when they're seeing their residents in aged care facilities, to take some vaccines with them and provide the vaccines as part of their usual care. If your clinic isn't vaccinating and you've got residents in aged care facilities, have a chat to the aged care facilities and sort of see what their plans are. A lot of aged care facilities are supported by community pharmacies, and those community pharmacies might be able to provide vaccines to the residents whose primary care provider aren't doing them. The Medicare flag fall payment has been increased to $118.15. That's a flag fall for the aged care facility, but it's also a flag fall for people in the home. So if you have some vulnerable people or some elderly people who are in the home who, your GP usually goes out there once a month and does a review, by all means, they can go out and provide the vaccine in the home and claim that $118 plus the suitability assessment as well. So we're encouraging COVID vaccines as part of usual care moving forward. So in particular, take note when, your GPs or your nurses are reviewing chronic disease management plans, throw a question in your plan. When was your last COVID vaccine? If it was a while ago, opportunistic, do it then and there if you can. Also, what we're trying to encourage is patients who don't generally see the GP very often. Like I know my husband, relatively fit and healthy, doesn't go to the doctor very often, but when he does go, sort of, you know, try and encourage those group of people who aren't at the GP very often. Oh, have you had a COVID vaccination? When was your last COVID vaccination? And try and, use the opportunity to get it done and then and there if they're interested. They may not be, but sort of, I guess the goal and the target is moving forward. COVID and COVID care will be business as usual within primary care. Next slide, thanks, Sharon. Back one. So GPRC's general practice respiratory clinics have closed down in Ballarat, Ocean Grove and Geelong. Horsham remains open, but it's operating under a bit of a different model, and the Warrnambool GPRC is state funded, so that remains open until the end of October. Keeping in mind for those in the Warrnambool region, the GPRC there can see patients with associated respiratory illnesses. So that might be kids that are a bit raspy, ear infections, those sorts of things. By all means, they're okay to be seen at the GPRC. So we sort of say loosely with associated respiratory issues. You wouldn't send somebody to the GPRC with a cut finger because that's not in any way associated. However, that's only for the Warrnambool GPRC. In Ballarat and Geelong, they have PPCCs. So moving forward with the GPRCs closing, you guys in primary care may see an increase in people coming to your clinic or wanting appointments for respiratory assessments, antiviral therapies, treating of COVID and management of symptoms. So I guess encouragement to your GPs and your practice staff that these patients are needing healthcare, and primary care is the best place to receive that healthcare. So this is just for mild to moderate COVID diagnosis in people who have mild to moderate symptoms. If people have severe symptoms, they are still being continued to be looked after via the public health units. But a majority of the community, as we know, COVID for a majority of the community is mild to moderate, and they will be accessing the usual GPs or primary care providers to have that treatment. Next slide, thanks, Sharon. So workflow in your clinic, a few things to think about would be use telehealth and use your digital resources that are available within your clinics. As Sarah said before, her team is always willing and happy to answer any questions and yell out to them if you don't know anything or you need some assistance with setting things up. I know working in practice, digital health can be a bit scary and it can all be quite difficult to set up, but once it's done, it makes everybody's life a whole lot easier. Some other considerations could be to allocate appointments for COVID positive patients or for a respiratory positive patient, like people with respiratory issues at the end of the day. If you can, allocate them to sort of one part of the day to try and keep, separate. And also ensure that your administration teams are aware of what's going on, that they are aware that, to ask the questions on the phone, do you have respiratory issues? Are you COVID positive? Okay, well, we're allocating these patients to the end of the day. Just make sure that everybody in the team is aware of what's happening within the organisation, and continue to ask questions for the patients that are booking in for appointments, and have your prompts on your online booking systems. I know that a lot of clinics have got the prompts up there. A lot of them have, some of them don't. Some clinics have amazing messages on their waiting lines, others don't at all. So we're just encouraging everybody to make sure that on their online booking systems and on their phone messages that they have simple message, are you COVID positive? Can you, if you are COVID positive, we're allocating appointments to the end of the day, or please ensure that you bring a mask, whatever it may be that works for your clinic. GoShare packages are also available for COVID positive patients online, which is like a text message GoShare bundle that can be sent off to the individual. So we know that all GPs and primary care providers are time poor, under-resourced, understaffed, flat out busy trying to get back to business as usual. Some patients you may have that come to your clinic could be the worried well, who, oh no, I've got COVID. Oh, it says to contact my GP. I have to contact the GP, and some people just need that bit of reassurance. So via getting a text message out a couple of times over their positive infection that can reassure them and send them on to appropriate links and resources, you know, that can just be the reassurance that they need. Oh, well, my doctor's clinic has sent this to me. So, you know, it is a source of truth. They are all official websites and information that's being provided via the GoShare bundles. And also something that I forgot to put on my slide here just at the end, policies within your clinic. It's really important that you've got strong and appropriate policies in place, and that you're also providing that information on to your patients. So if you are a clinic who, you know, is requiring everybody to wear a mask, make sure that your patients are aware of that, and make sure that you've got a policy in place and that is displayed for your patients, and that it's reviewed often. You know, have a review schedule and ensure that it is reviewed and updated often. We get quite a few queries in regard to patients and staff as well wearing masks in clinics. Unfortunately, the Victorian government sort of didn't support primary care in making rules. In other states, there was sort of support there. Excuse me. In making rules, and pharmacies and general practice were part of the guidelines, you know, of a vulnerable setting. Victoria didn't have primary care, or pharmacies weren't part of those guidelines. It was just for state health services and sort of state funded and supported facilities. So as small businesses, and you know, it's essentially up to you guys. If you decide that this is what you want to have in your clinic, if you want people coming in with masks, if you want your staff to wear masks, the responsibility is on you guys to develop the policies and have the policies in place to support the wishes and the needs of your organisation, just as it is, you know, staff uniforms. Do you have a policy in place for staff uniforms? Do you have to wear closed-toe shoes to work? You know, do your staff need to wear a mask? Just develop the policies that you have within your organisation to support it, and also, you know, ensure that if those policies affect your patients, ensure that those policies and that messaging is provided to patients or accessible for them. So that's all I have for me, I think, at this stage. Thanks, Sharon.
Awesome. If there's any questions, because we're a bit short for time, I will get you to write them down and we'll give them all to Annie to answer, if that's okay.
No problem.
I just want to introduce George. George is going to come down. We're going to unplug my computer and put his in. George is passionate about compliance and reducing the risk of this. Yeah, I'll let you do that.
I'm doing the room. Okay. Oh, hello everyone online. Sorry.
Do you want to come on, jump on?
Let me, I'll unmute everyone from here.
Sure.
Can everyone hear me? Yeah, they can.
Yes, we can all hear online.
Thanks, Kim.
Sorry, everyone. I'm generally really difficult. A second. Sorry, everyone. Just while that pops up. Yay, there we go. Excellent. So let me just share my slides quickly. All right, how am I going? Share. Looks good. How's that? I've done it before. Hi, everyone, and hello to everyone online. I'll do my best to obviously look at everyone. I'll probably get distracted because if everyone who knows me, I generally roam around and talk with my hands. But I'm George Sotiris. I'm the Director of Health Industry Employment Services. I feel like there's so many familiar faces and obviously names that I saw coming in we do a lot of events obviously throughout Vic. And I'm the Director of Health Industry Employment Services for the last 14 years of my professional career. We've supported primary health practices nationally. 10 of those years I was with the AMA up in Queensland. For the last 4 years, obviously under my own umbrella, HIES. And we live and breathe GP specialists, allied health, not so much dental, but the first three. And it's all about creating compliance with our systems and processes. So obviously I'm very thankful and grateful obviously for being able to be here today as well, all thanks to West Vic PHN. And, does everyone remember me from the roadshow I did? Yes, that's right. Obviously, I'm the only mad person who will go from here to Warrnambool to go to the day spas, Ballarat, to go digging for gold. There's actually a gin distillery out there too, if you didn't know. So, and actually I didn't make it to the hot springs in Warrnambool, but for everyone from there, next time, just make sure you save me a spot. But it was really great being able to go out and obviously provide education and updates. And that's really what we're passionate about. We love providing education on all of our systems, processes, because we've got a great and a very competent team that deals with issues on a day-to-day basis. And HR is the easiest part of our job, isn't it? Insert laugh there, man. It gets crazy. We even on the way down here, I was dealing with a bullying allegation this morning that's just come through from a basic breakdown in trust and communication from two staff, and everyone is generally short staffed still. How are we all going with staff? Are we slowly filling up our rooms? Yeah. East Vic is getting better. I had a practice that has been severely short staffed call me up saying, George, we've got too many nurses now. I'm like, what? How's that possible? For the last, couple of years, it's been short staffed and we've got to pay them high 40s to $50 an hour to get them in the practice and working. So obviously the COVID trends are slowly settling down and the workforce is getting a bit better. But what we're going to cover today, Sharon, how much time do I have? Minutes. Okay, 40 minutes to 20 minutes. Watch this go. So we're going to go through the legislation changes. A lot of people have heard about some of these changes, but there's more. Even since the last fortnight, you may have heard about the parental leave updates, which I think will have quite a drastic change and look on how we manage staff going on parental leave. And if we have time, I'll go through the latest HR issues and trends that we're seeing. But has everyone got their phone there? And actually, what I might do, I might skip this for now just because of time, and then we'll go through to it after. But let's talk about legislation updates. Obviously, hearing all the updates from all the PHN staff is amazing as well about how things are just evolving now that COVID is slowly passing us. But from a HR and an employment perspective, we have seen some of the biggest updates and changes in over 2 decades. Since the Fair Work Act was introduced in 2010, we've had the biggest introduction of law. So I'm going to provide a bit of a summary on how it impacts your contracts, your processes, your systems, and from there give you all the key takeaways you have to consider. But has everyone heard about the parental leave scheme changes over the last couple of days? And it literally has only been over the last couple of days. Again, this isn't something the employer has to pay, like paid family and domestic violence leave. This still sits with the government. However, the key changes that have occurred involved a steady increase of that amount. So obviously, if the wording as well is very particular, so obviously if it's a birth or you have entry into care of a child from 1 July 23, what will change and occur is there will be an increase from your 90 days, which is currently 18 weeks at the minimum national wage, which is roughly around $800 a week. That's going to increase to 100 days. So that's 20 weeks of paid time over a period of, 3 years? So till 2026, that's going to go up to 26 weeks paid time from the government. So again, these increases have been in the pipeline for a while, but it's obviously starting from the 1st of July 23. And what they're doing, it's no longer a separate dad or partner pay. It's a combined entitlement for spouses to access. So that just simplifies things a little bit from when they can take it and they can take it together, which was a big issue in the past. There is still income assessments tests that the individual employee will have to adhere to and apply. And obviously it's a combined income of $350,000. And obviously individually it's 156,000. So again, it's not your obligation as managers or employers to have to really do a lot of the running work in the beginning. I think what's more interesting is the point I've got at the bottom there, where this can now be taken across 2 years or until the child turns 2. So at least you always knew with obviously the date of a staff member having a child, it was 12 months from that period. And there was very strict timelines on when they could take that paid parental leave. However, now it can be at any time between the birth or entry of care for a 2-year period. So again, it's looking at how do you manage that? What does the process look like? We have started developing certain policies and processes that just have clear communication of when someone's planning to take it and when they are obviously having your forms ready to go from 1 July to make sure you know. Because if you have to backfill this person, how do you then get fixed term contracts if they want to have 6 months here, 6 months, 18 months later, 12 months later? So again, it's another sort of complexity from a workplace perspective of how do you employ it, but more so how do you backfill it? Because you're still contractually obligated to make sure the person you've put in to replace them is aware of how long they're going to be there for as well. So just understand these key points, and it's not so much that a lot of this legislation impacts you as employers, it's just a period of time and when the leave can be taken will be another layer that you'll have to consider. So again, if they don't take it within the 2-year frame, they lose whatever remaining balance they haven't actually accessed. Any questions there? No? Yeah, this will apply to casual staff who have had, it's still the 12-month of continuous or engagement or service employment in the 12 months prior. So casual staff will still be eligible for paid parental leave under the government scheme. Who's got a parental leave policy? If you don't, consider it, because you can have things in there like keeping in touch days, which is all about if you have new program software, or you might want to offer that an employee can come back for up to 10 days in that 12-month period or 24-month period now, whereby they can be upskilled, be part of the team still, and still have their recognition of maternity leave as well. So the clauses under the National Employment Standards will not change. But again, keep an eye out for it. There will be more coming out, but that comes into play from the 1st of July. So the next key points I want to talk about, and we've probably all heard of it, and I might get, even though I can't see too many people, I'm just going to, I think someone's trying to get in. Has everyone heard about the new Fair Work legislation, the amendment bill that was introduced? It's not even a couple months old. So with addressing pay secrecy or the new sexual harassment legislation and laws, if you haven't, the backbone of this obviously happened really quick. Even as professional advisors, we keep up to date with a lot of the legislation, but this passed extremely fast. And there's a bit of a timeline on the screen there that outlines when it was introduced, when it went to Senate, when the bill was received royal assent to now. And even on the 6th of March, they've staggered obviously when certain points are introduced, but the sexual harassment legislation under this new bill came into play 2 days ago. So this snapshot here gives you all the key areas. Some are completely irrelevant to us in health, but the key ones that I will cover off are looking at your pay secrecy, your claims. So claims and disputes have changed significantly. So the caps and how employees can lodge back payment of wages claims. Obviously, the sexual harassment is a big one because we've seen a massive spike in sexual harassment claims in the last 12 to 24 months. Fixed term contracts. And again, with the new maternity leave provisions, that makes it even a little bit more difficult. So they've now capped how many years you can have fixed term contracts for, which for most practices that run things correctly isn't a big issue, but we do see a lot of practices with ongoing fixed term contracts, which, we generally question to say that's really not ethical or correct and creates job security issues. So, and that's the part of this bill is all about creating more, I suppose, quality and job security in the workforces. With the Albanese government, we're seeing a big change in, I suppose, removing a lot of the casualisation of our workforces to offer more permanent positions, increase the equity in wages. And things that I haven't got in here, they're talking about employers with over 100 employees, which we do have quite a few members with over 100 employees. They're trying to pass legislation that outlines you have to display to a public body your pay gaps. So again, you can imagine having to publish this, which then becomes a public record to this entity. So again, it is something that we'll see how it all goes and unfolds. But I'm going to cover off some of the key points here, and I've got a slide on each point. Prohibiting pay secrecy. So are we across this, or can I have a show of hands? So I know I can't see everyone online, but has everyone heard of the pay secrecy provisions? Have we done anything about them in our current contracts? No. Which is fine. We generally only have, you will generally have a couple sentences in there, and you have until the 7th of June 2023 to ensure that those provisions are removed from your contracts. Any current contracts with the pay secrecy provisions in there. And when I talk about a pay secrecy provision, that's a clause that states you must not disclose or talk about your rate or remuneration or terms of your contract with other employees of the practice. Again, it's all about creating transparency, and this is the intent of that new bill, is to allow people the ability to talk about their rates, to then give them better positions to negotiate when speaking with the employer. But here's a good story for you. You've got George, who's a high performer, I like to think so, who does 10 times the amount of output, is there early, will stay back without an issue. And then, what's the name? Sharon, who's to my left, who, will do the bare minimum, will come into work, will always, come in at 9 o'clock. This sounds right, doesn't it? Come in at 9 o'clock, make her coffee, go to the bathroom, chat with everyone, start at, 9:15, and we'll be gone at 5 o'clock on the dot. Why does George get $5 more than Sharon? Sorry, it should have been the reverse, shouldn't it? Sorry. Sharon's next to me, everyone, just choking me. But again, the ethics and the cultural issues that will come out of this will be really interesting. And I think having structured performance reviews and other processes to actually provide feedback to staff if they do start discussing it will be a big point. But it might change the way if someone is talking about, well, why is George getting paid more than me? Again, it might be that discussion to say, well, we evaluate our rates based off performance, duties, and accountability in the practice. And it's just so happens to be that this role does more than your role. So again, review processes are extremely important. We've been working with a handful of practices in our little community about introducing quarterly reviews. And these are development reviews, whereby you have the opportunity to openly discuss about, roadblocks, areas of improvements, little goals and things you implement each quarter. And any disciplinary or underperformance related issues get addressed along the way. So you're not saving up, all the issues and concerns with their employment in, one 6-monthly or annual review. So again, providing more regular feedback works. It creates better transparency. It holds your staff more accountable. And you're probably all thinking, George, where the hell are we going to find a time to do a quarterly review? 15 to 20 minutes max. Do not spend any more than that on these reviews. Unless obviously there are circumstances that you need to, but they don't have to be an hour-long review with, 30 pages of, forms that need to be filled out and scoring yourself. So again, work with what does yourself, but your contracts will need to change. Your confidentiality policies, if you do have them in practice, they generally have something in there about remuneration and not discussing staff affairs or rates. So you are legally obligated to have to change them by the 7th of June 2023. And for anyone starting with you afresh now, you need to make sure that those provisions are removed from contracts. And we can review them even if you're not members. We can have a quick look and point you in the right direction as well, which we've done for a lot of practices. So actually, I've got good news on the end of that as to how you might be able to get advice from us on them too at the end. But I'll save that for the punchline.
Okay.
We've got 10 minutes?
Yeah. Very
Okay.
good. And I've got one question here when you're ready.
Oh, excellent. I'll keep powering through, and if we can get to questions at the end, we will. So there are new, again, this won't impact your practices significantly. It may impact some of the wording of your discrimination policies, but they've included gender identity, intersex status, and breastfeeding as new definitions under the protected attributes. So if you've ever seen definitions of discrimination under the Act, you'll see religious status, union involvement, gender, and everything else. So there's 3 new personal characteristics that have been introduced as part of the bill. All your discrimination laws are still the same. There was still the ability to lodge discrimination complaints with your state bodies. So again, we're not seeing a massive change from that side, but it's just making sure that you're aware if you do have policies that have that list, include the 3. This is what I want to talk about. As I mentioned, we've seen a massive spike in sexual harassment complaints and issues in private practices throughout the last 12 to 24 months. And I don't know what's the biggest stem or cause of it. Some is just completely inappropriate. The 3 big cases we have had is just relationships getting too comfortable. And I've shared one story because I have to, which will push us over our 10 minutes. We have a practice in Northern Queensland. They have a scenario where one of the receptionists, junior receptionists, and one of their fellowed, regos that fellowed, had a great relationship, pick each other up. They'd go to the gym together. They would, in the workplace, just be very friendly, and they would call it flirting. So the manager, everyone could pick up on it. Everyone could see that they've got a relationship going. What happened in the scenario? The doctor got the confidence, went to the junior receptionist and asked her on a date. Receptionist turns around, puts a sexual harassment complaint into the manager. It was unwanted, unsolicited. I can't work with him. And that's sexual harassment. And the manager turned around to me, she said, George, what the? They flirt all day. They pick each other up. They go to the gym together. There's clearly something going on. I was like, how can she do this now? And it was obviously caused a lot. But in this scenario, there's 2 big caveats to it. She had seen that doctor as a patient of the practice, just to add another layer of complexity to it. Doctors can't see patients of theirs, can they? Because then there's APRA issues. Obviously, this is now with the MDO, with the indemnity insurer, just for making sure everything's covered off. But we're trying to mitigate the relationship issue, because what happens when a scenario like this happens in your clinic? What happens with these 2 doctors, and the doctor and the receptionist now? Sorry for everyone online who might not be able to type your answer in. What happens? Because they're not going to the gym anymore. They're not being picked up anymore. They're not being asked for coffee anymore. So what do? They ignore each other. And what does a sexual harassment or a breakdown in trust or relationship happen? What does it then turn into? Bad culture. But now the doctor's bullying me. He's ignoring me. He's inviting everyone else for coffee. He's got a new gym buddy. Sorry, I just threw that last one in. And that's a very typical scenario with any form of bullying related cases or issues you have in practice. It generally happens from, a good working relationship that breaks down. And then obviously if there's no resolution or point to actually address it, it then generally turns into a bullying matter if there's that isolation and exclusion. So again, with the sexual harassment provisions, what has occurred in the new legislation, Fair Work now has the right to deal with sexual harassment related issues in practice. So now this staff member has put a complaint into the practice, and they can't isolate each other from working. So now if, for argument's sake, the doctor, who's obviously completely stepped away and not in any inappropriate circumstance anymore, turns around and does something inappropriate, because there may not be a lot of measures the practice has put in place, this staff member can now go and put a stop sexual harassment order in with the commission, who would then come in, investigate, see what's happened, looked at the notes, looked at the points that have occurred, and then actually file an order to address how this is to stop in the workplace. There's no financial gain or compensation, but it'd probably end up just being a work cover issue. So again, it's important that you update your policy. There are positive obligations under this new legislation that employers need to take. So like, I forgot the last lady that presented. She made the very good point of reviewing your policies, making sure they're up to date. And from that side of it there, you need to ensure that you can demonstrate that your policies are up to date and that you do training on them. That's why I travel around so much, because we're generally doing a lot of training with staff on implementing policies. What's your? Oh, good. Okay, good, perfect. Yeah, so from that side of it, review your policy, document your training. If you have, does everyone do your staff meetings or practice meetings? If you're doing weekly, fortnightly, monthly, every 6 months, whenever it might be, have standard agendas on there. Make reference to your policies, talk about WHS, talk about, your core issues, and make sure they're minuted so you can use those little steps along the way to demonstrate how you've enforced your policies in practice. So a big one, and I think I've spent more time on that because we're seeing a lot of issues. So again, there's extensions for unpaid parental leave. So this has always been in place where someone can have 12 months off, but extend a further 12 months to have 24 months off. Now, again, the commission is stepping in and an employee can go to the commission to say, well, my employer said they can't do it, but they didn't validate the reason why. So now you have to provide specifics as to why you can't accommodate someone's extension. And if you don't have any valid reason, obviously the commission can be involved to look into why that's occurred. So you have to make sure you follow your consultation process. There's consultation provisions under the NES and award to deal with these problems, but you should be getting professional advice if you're ever going to decline someone's request. But something as simple as we're losing a doctor, or 3 of our registrars are leaving, or whatever it might be, would be enough to potentially have valid grounds for a request or denying a request. So again, or you might be gaining 3 registrars, so we need you to come back to work. So make sure you get the right advice if someone is asking to extend it. And again, that applies for the flexible work request. So if someone's going through a DV order, there's caring obligations, there's coming back from leave, all those new provisions of providing the right evidence will fall under that point. I made a comment before about fixed term contracts, and we predominantly see these when staff are on maternity leave contracts, or respiratory clinics are a great one because it was all based off funding. And we just heard earlier that 3 of the respiratory clinics have closed down in the different regions. We saw a lot of fixed term contracts that were funding based on those arrangements, but we just have a lot of practices which we've advised for years that it's inappropriate, that just like a public hospital will give fixed term contracts to their staff. And with the attempt there that, oh, well, if we don't like them after, 2 or 3 years, or after their, 4th year, we can just end their contract, which we have always advised will never stand because there's an expectation of ongoing work. It's not like they were there to do a project or they got funding from the PHN to do a particular project. So now they've capped it to 2 years, and you can have obviously consecutive contracts in that 2 years. But again, unless you have legitimate reasons to go over 2 years, like if you've got a 3-year respiratory clinic and that's all you've got funding for, you can go above that 24-month term. So if you have fixed term contracts, review them and get advice around them, especially if you're going over 2 years. Or if you regularly use them at the moment, you might want to stop using them if there's an expectation of ongoing work. Any questions there? Small claims. I'm not excited about this, but I'm excited to see the case law that comes out of this. We work with a lot of practices, and our strength is compliance with the HPSS and Nurses Award. So we did reviews with 3 practices last week, and I actually had the pleasure of doing all 3. So that's why I've got bags under my eyes, because they go for about 4 to 5 hours each. All 3 practices were not paying their nurses the 5th week of annual leave. one practice has 12 permanent RNs, and they're regional, and much like going out to, but they're in central Queensland. I know you're probably saying, are we paying it? Are we not? Go double check your payroll system, because 2 of the practices that I reviewed, we've been supporting for years. And in a room like this, they would have sat here 40 times listening to me say the same thing when we did the review and actually looked at it. Bye, see you later. That's all right. All 3, as mentioned, had not actually had it set up in the system, but they knew that they had to do it. So again, doing the reviews, understanding it, and the reason why I'm using that scenario is because they've increased the cap now from 20,000 for the small claim up to 100,000. And 3 of the staff in the practice that had been there for 15 odd years, their back pay claim was over 20 grand. So now with this new legislation, obviously there's a Fair Work district in the small claims circuit or court whereby they'll be handling back payment of wages claims, and now that caps up to 100 grand. So we're going to see a lot more. There's a lot more awareness. Plus, what is the first thing that comes up when you type, my employer is underpaying me? Would you like to make a claim? In a very quick link. So there's a lot more information and knowledge out there. This is where, as managers and practices, you have to be proactive. The compliance falls back, yes, on the employer in the end of the day, but it's within everyone's roles to make sure you're paying things correctly. So again, we will see a lot of case law that comes out of this across all industries, and it's a lot easier for that. Timelines.
We're sort of there, but
Sort of there.
I was hoping that you could talk about the other exciting news that we've got.
Yes, and if everyone gives me 1 second, I'll just grab my iPad too.
And quickly, if you've got the evaluation form, if you can take that and give us an evaluation, that would be great. I've sort of put it on everyone's seat. Thanks.
Thank you. So, so everyone knows we work really closely, obviously with various PHNs and more closely with the Western Vic PHN. And over the last period, we've been actually trying to figure out how can we make services, reviews, and points that I've just covered off in, 20 minutes? There's so much there. How can we make knowledge and support more accessible to practices? So what we've been able to come up with is an expression of interest to commence, which obviously Sharon and Diane will be sending through to everyone to have half-hour sessions with myself and the team. So all health industry experts in employment law. And what we'll be looking at is effectively, you can come with any series of questions you want. We've got key trigger questions that we want to tick off to ensure your compliance is in order. It might be using that half an hour to reclassify your staff in the practice. Who's ever struggled with that? What level do they go? They're level 1, 2, 3, RN level 2 or 4. So you can take this opportunity to review your systems, your processes, or come with questions. Things like the contracts we mentioned before, we can look at your contracts, and obviously the PHN will be funding these sessions, which is amazing, and throughout obviously the regional areas too, where it might be a little bit more difficult to have the support that we offer. We will be locking that in, so you can book in your half-an-hour sessions and get support. But obviously, it is limited to a certain amount of practices, and if this sort of pilot works well, then great. If we can continue offering it, we love to, and that's why we provide so much education to practices nationally. The whole attempt is to make a difference in every clinic. So this is a personalised support with really no strings attached for you to use us as much as you can within that time to make a difference with your employment foundations. And we'll have a list of topics and points that we've put together just to give you ideas around, or have we reviewed this recently, or how we're tracking from a compliance point. So again, with all the change, I find that it's such a great opportunity to take on board. And again, thank you to Sharon and Diane for figuring out and having the clever idea in the first instance. So we hope to have you all in those sessions as well booked. And the great thing is the booking side of it's so seamless. You can pick whatever time throughout the advisors' diaries, and we'll be there to support.
Thank you.
So
that's wonderful. Thanks,
great.
George. I know we've pushed you for time, but you've
That's
done
all right.
amazing as usual.
That's
So,
okay.
I just want to give George a quick clap.
Thank
He has done a great job.
Thank you.
Please help yourself to more food if you'd like some, or a coffee, or just a chat. And thanks everyone that's been online and
Thank
all
you.
the other regions. We'll see you later.
Bye. Thanks, everyone.